There are some patients who suffer from a weak-sounding voice, or it starts out strong and clear, but then weakens after a few hours of talking. In such patients, this weak vocal strength is due to weak muscles of the voice box. And just like any other muscle in the body, it can be strengthened through dedicated exercise to become stronger. Here's an example of normal vocal cords with normal muscle tone. Note how with phonation, the vocal cords come tightly together with no gap in between. Here's a different patient with complaints of a frail-sounding voice where the vocal cords appear thin due to underlying weak muscles. See how there is a persistent gap between the vocal cords resulting in air leakage, which results in a weak-sounding voice. Believe it or not, there are 4 different vocal cord muscles responsible for creating a voice. To have a strong voice, different vocal cord exercises are required to strengthen each of these different muscles. The exercise regimen basically involves 3 different vocal tasks, each of which can be done briefly several times a day. These 3 exercises need to be done assertively using a loud projected voice. Imagine talking in a loud, crowded room, where you're trying to be heard but without coming across as screaming. It should be a short but very intense burst of vocal use. The first vocal exercise is called the voice of authority, and it is spoken at a low to mid-pitch range. Long ago, people found it was easier to travel on water than on land. You should have the sense that you are really exerting yourself with the voice of authority. The second vocal exercise is the voice of alarm and is spoken at a high pitch range. It is the voice one would use to yell a warning to prevent a terrible accident from happening, say a child crossing a street when a car is approaching. Stop! Watch out! There's a car coming! To use the same sentence as before, long ago, people found it was easier to travel on water than on land. Finally, the third vocal exercise is simply a loud siren, making a gliding sound from as low as possible to as high as possible, and then back down to low. Each vocal exercise should be performed for about 20 seconds, but not more than 60 seconds each. Ideally, perform these exercises 3 or more times a day. It doesn't have to be a specific sequence of words. You can sing a song, recite a poem, read a book, etc., whatever suits your fancy. Keep in mind that it's not the actual loudness that's important, but the effort to be loud. Initially, after doing these exercises, the voice may sound more weak and fatigued compared to how it sounded immediately before doing the vocal tasks. However, this is normal and no different than how any other muscle may initially feel weak and fatigued after exercising a frail arm or leg muscle. However, after about 2 weeks of diligently performing these exercises, you should start to see results. If improvement has occurred, continue performing these exercises until a plateau is reached. This improvement may be different for different individuals. Some will report an outright stronger voice. Others will report their voice still sounds the same, but it can last much longer. For those where no improvement has occurred at all, it may be worthwhile working with an experienced voice therapist. Ultimately, even surgical options can be considered. Keep in mind that you should not be screaming when you do these exercises in order to minimize any risk of vocal cord damage. Instead, use a loud projected voice.